As the death toll mounts from the novel coronavirus, questions are rising about whether U.S. officials might have gotten it wrong about how the virus spreads. On March 1st, Secretary of Health and Human Services Alex Azar said on ABC's This Week that it's mainly spread by people who are already sick.
You really need to just focus on the individuals that are symptomatic. It really does depend on symptomatic presentation.
The website for the Centers for Disease Control and Prevention saying the same. Can someone spread the virus without being sick? The answer from the CDC, some spread might be possible before people show symptoms, but this is not thought to be the main way the virus spreads. But in Massachusetts, more than 80 people contracted coronavirus at a conference held by this biotech company. The State Department of Health telling CNN that none of the people who attended displayed any symptoms during the conference. Epidemiologist Michael Osterholm is director of the Center for Infectious Disease Research and Policy at the University of Minnesota.
We now have conclusive evidence that this disease is also being transmitted through asymptomatic carriers or people who show no symptoms, and trying to stop that transmission is like trying to stop the wind.
And this study, which has yet to be peer-reviewed, found that in Singapore and in Tianjin, a city in China, infection was transmitted about 2 to 3 days before symptom onset. And that makes the outbreak much more difficult to control.
Honestly, with this kind of transmission, we're never going to stop it. What we best are able to do is slow it down.
None of the experts CNN spoke to could say exactly what percentage of people are getting infected with the virus by people who don't have symptoms. CNN reached out to Secretary Azar and the CDC, but did not receive responses. On Saturday, Dr. Deborah Birx, the coordinator of the White House Coronavirus Response Task Force, sent a somewhat different message, suggesting that people under age 20 could possibly be spreading the virus without having any symptoms.
And until you really understand how many people are asymptomatic and asymptomatically passing the virus on, we think it's better for the entire American public to know that the risk of serious illness may be low, but they could be potentially spreading the virus to others.
Some experts say this is a step in the right direction, but still.
This is a time for straight talk. This is a time when we have to tell the public what we know and don't know.
A time for straight talk about a virus that might be spreading in ways we hadn't anticipated. Now, when a virus is spread mainly by people who are sick and really showing symptoms, it's a lot more straightforward to control it. You isolate the sick people. But when a virus, when asymptomatic spread is really at play, as appears to be with coronavirus, as Dr. Osterholm said, it's like trying to stop the wind.